Now we get to talk about some very important imaging modalities in orthopedics, and this is ultrasound. We also talk about computed tomography, and also the magnetic resonance imaging. So for each one of them, we'll be describing and also talk about the most favorable type of disease conditions that you might actually want to employ any of the imagings. So the first image here we have is the ultrasound. So ultrasound in orthopedics, of course, you can use it in other specializations of medicine, but here we are always talking about orthopedic stuff. So it uses high frequency sound waves, and it will help you to create real-time imaging. As this person is moving the joint, you are seeing it real time on the screen. So applications can be used to evaluate soft tissues, tendons, ligament, muscles. That's why you see the shoulder joint there. Dictate effusions if there's there's a fluid accumulation, abscesses. It can also help you to guide you if you want to do any procedures. Let me say I want to put a needle here. So I'll be using the ultrasound so that it's guiding me so that I don't actually injure any structure there, Then dynamic assessment. So advantages is portable, it's inexpensive compared to other ones, and it gives you a real-time imaging. Okay, so the next one we have is computed tomography. So computed tomography uses x-rays and computer processing to produce cross-sectional images. This is an image from a computed tomography. So applications in orthopedics is for bone detail, for fractures assessment, complex trauma assessment, cortical breaks, Then pre-operative planning. So you want to actually visualize the place before you go in for operation, so that the person is actually precise and know the exact thing to do. It will help you to dictate bone tumors, metastases, bone healing. It will evaluate spine issues, all those disc calcifications, fractures, herniations. So advantages, it gives you a high resolution, very good images for both bones, and it's very fast. Okay, so next one is the last one, which is the magnetic resonance imaging. So these are pictures of MRI. Okay, the T1 weighted, the T2 weighted. Okay, all of that. So it uses strong magnetic fields and radio waves that can be able to visualize the tissues. So application in orthopedics is it gives very good images. So easy to actually all those soft tissue imagings, ligament, tendons, cartilage, menisci, muscles, bone marrow pathologies, spinal cord issues, cord compressions, disc herniations, inflammatory arthritis. Okay, so advantages, it gives you a superior type of image. Okay, very clear image than the other ones. So and no radiation here, so the patient doesn't stand all those chances of side effects and all of that exposure to radiations.